Dear friends and colleagues, today I'm going to share with you one of my cases for treatment of atrophic maxilla at the canine and premolar region using a combined technique with bone expansion, LBRF, and sticky bone. You can see here the thickness of the ridge is about 2.5 millimeter. We prepare the LBRF using clot activation tubes with a speed of 2700 RPM for 12 minutes, while the sticky bone we prepare it with the yellow tubes with 2700 RPM and 3 minutes. After proper anesthesia, we start with the incision. We should be sure where the incision is going. I prefer to make a bone sounding to be sure where is the crest of the ridge because we have only 2.5 millimeter thickness of the ridge. If the incision is more labial or palatal, we may have laceration of the flap. It will take time for cleaning. In addition, there will be a lot of bleeding, which is interfere with the visibility during the implant procedure. After proper reflection, we start with the incision. We go with the initial drill to this desired depth of the implant. After that, we start with the expansion. Of course, with the expansion, we should be very careful. We can use either the densiber or the bone expansers or the osteotome. I do not prefer high-speed osteotomy, while during the expansion we use a very low speed. At the site of the canine, we have to follow the angulation of the bone, so it is a little bit labially inclined, which may affect the final X-ray picture. But we can see here during the osteotomy, it is parallel to the lateral incisor, but it is little bit labially inclined implant. Then is the expansors. We start with the small size, then gradually increase the size of the expansor corresponding to the desired implant. We can use it with the handpiece in clockwise and anti-clockwise motion, or we can use it with the ratchet. In most of the conditions, you can insert the expansor with the handpiece. Sometimes during the removal, we need to use the ratchet. This is the first implant. I used implant 3.2 millimeter with a length of 11.5 millimeter, while the other implant is 3.7 millimeter and 11.5 millimeter length. We can use the ratchet or the hand driver to be sure that we insert the implant to the desired depth. After that, we use the cover screw as usual. Then we start with the augmentation. Of course, we can cut the sticky bone by scissor as we see and start the condensation. Be sure that the condensation to the full depth of the implant. We can use bone condensers. We augment both labial and palatal. Then we apply the LBRF membrane. I prefer double layer. I put a layer buccal and palatal, then another layer from the buccal to the palatal direction. This is before securing. If we have a problem with the soft tissue coverage, we can use either fenestration of the periosteum or we can use the tissue brush to gain more mucosa. After proper adaptation of the LBRF membrane and the suture technique, we can add more secure for the bone graft and the membrane. We can use either the periacryl or periodontal pack. We can see here the difference between the width of the ridge at the start and by the end of the surgery. Please do not hesitate to contact me if you have any question for my cases through the YouTube or my email. Thank you, my friends. See you soon again.